People with learning disabilities have different health needs and experience health inequalities when compared to the rest of the population. People with learning disabilities experience conditions like gastroesophageal reflux disorder, also known as acid reflux, where contents of the stomach come back up. They also experience conditions such as sensory impairments, such as difficulty seeing or hearing, osteoporosis, where bones are not as strong as they were before and can break easily, dental disease, such as gum disease, musculoskeletal problems, such as aches and pains in different parts of the body, for example, a sore knee or a sore back, accidents, such as falling over, and nutritional problems that can be caused by eating too much or too little when the body does not get important vitamins to stay healthy. These conditions are more common in people with learning disabilities than other people. Only a small number of projects have looked at the physical health of people with learning disabilities, and most of the work that has been done so far does not include very many people. Sometimes projects only look at the physical health of people in different age groups, for example, just looking at the physical health of older people and not including younger people. Sometimes there are other problems with the way projects are carried out. This means we need more information and work about the physical health of people with learning disabilities. This will help us to better understand the health of people with learning disabilities and how to recognise and treat health problems. So, the aim of this project was to look at the physical health conditions of people with learning disabilities. How did we do this? The information for this project looked at the health of people with learning disabilities. The study included people with learning disabilities who lived in Greater Glasgow Health Board. Everyone was 16 or older. People with learning disabilities were asked if they wanted to take part in research about their health. The people who agreed were given a full physical health check. This was carried out by nurses and doctors. The health check helped the researchers to find out about all of the different health conditions that people with learning disabilities had. We looked at the information that was collected in these health checks. So what did we find out? 1,023 people with learning disabilities agreed to have a health check. 562 were men and 461 were women. The average age of the people who took part was 44 years. The youngest person was 16 and the oldest person was 83 years old. We found out that people with learning disabilities had lots of different conditions. We counted how many people had each condition. The average number of physical health conditions that people with learning disabilities had was 11. We looked at the types of conditions that people had, and we found that the most common conditions people had were painful, such as poor oral health, including toothache and gum disease, or conditions that caused disability, such as poor eyesight or poor hearing. And some of the conditions people had were possibly life-threatening, such as obesity. Most of the people who took part had 2 or more conditions. Why is this project so important? This project included a big group of people with learning disabilities. This means it is a good quality study. It can tell us what is happening to the whole adult population with learning disabilities. It tells us that people with learning disabilities have lots of different conditions at the same time. When we looked at the types of conditions that people with learning disabilities experienced, we found that these are often conditions that could be treated. In some cases, with good quality care, they could also be prevented from having them in the first place. We will share the findings of this research to help doctors and nurses to care for people with learning disabilities.